Tabor Missionary Baptist Church, and to now be this week here with you at Trinity Baptist feels pretty good, So, last week when I was at Mount Tabor, I followed a pastor from Louisiana. Exactly. I am not from Louisiana. I'm from Pasadena. We don't preach the same way in Pasadena as they do in Louisiana. But I'll tell you, the message is the same. So let me say a few things here. We are at a very, very important point in history. Okay. 50 years ago, Medicare was implemented. 50 years ago, we said our seniors should not be impoverished because they don't have health insurance. Okay? Now, people don't remember this, but when Medicare was implemented, it wasn't smooth sailing. When Medicare was implemented, there were people saying, this is a commie pot. And there were people that when it was implemented, that was also when we first put in place Medicaid, which is Medi-Cal here in California. Now, my dad worked at LA County Hospital, and he's an older gentleman, wrote a letter supporting Medicare. The local doctors tried to get him fired for supporting socialism. So some of this runs in the family. So we now look back, and we could not imagine being in a nation that wouldn't cover our seniors. Okay? Right? Well, let me tell you something else that happened 50 years ago. 50 years ago is also when Martin Luther King said, of all the forms of inequality, injustice and inequality in healthcare is the most inhumane. Okay? And he's absolutely right. So, what is Obamacare about? It's about justice. It's about, for the first time, us as a nation saying that health care is a right for every American, not a privilege. Absolutely. So you've got a great panel that can take questions, and I'm happy to take some questions if you want. But I'm just doing sort of a little bit of the basics of what the Affordable Care Act is, and then I'm going to. Well, actually, I want to start with a little bit of a show of hands from you. If you today have health insurance through your job, or through Medicare, or through Medi-Cal, I'd like you to raise your hand. Raise your hand. Now, okay, I'm doing a quick skim. Okay, put your hands down. That was about 84% of you. Which is actually how things work in America. Which is about 84% of people have health insurance. Now, if you raised your hand, and this is important, Obama's been saying this, if you have employer-based coverage, insurance through your job, keep it. You're in great shape. You got Medicare, the Affordable Care Act just made it better. Keep it. You're in great shape. But if you're one of the 5 million Californians that's uninsured, it is a new day. Okay? For the first time, starting 1 month ago, insurance companies can no longer turn you away because you sneezed once. You can't do that. Okay? And financial help to help every American afford health insurance. That is a new day. Okay? And with leadership from people like Senator Mitchell, California expanded Medi-Cal. So what we have is 4 million Californians are going to get a financial leg up. Those eligible for Medi-Cal get free coverage. Good coverage, you pick private plans through Medi-Cal. You make a little bit more money, you get a financial subsidy that you use to pick the private plan you want through Covered California. It's that simple. It's a private marketplace. This is not a big government takeover. This is private health plans. You decide. Here in Los Angeles, 6 different health plans you can pick between. You can pick Kaiser. You can pick Health Net. You can pick Blue Cross. You can pick Blue Shield. You can pick Molina. You can pick LA Care. Did I get 6? I got 6, thank you. Okay, and it's your choice. You pick it. Okay, but this is a very, very big deal. And it is not, I like to say that it's not about Washington anymore. It's not about Sacramento. It's about Trinity Baptist. It's about covering your congregation. It's about covering this community. And so I want to ask another show of hands, which is, Do you know somebody, a brother, a sister, a niece, a neighbor who does not have health insurance? Raise your hand. Raise your hand if you know. So that is virtually every one of you knows somebody. Okay, so now I have a favor to ask of you. Now, if this were Sunday, there would be little baskets being passed around, right? Is that right? Okay.
A big basket.
And some big baskets, you know, so it depends on the church. You got different size baskets. I'm not going to go with it. So, okay, so you get those baskets, and would you put something in there? You know you would. Well, I want you to give something today, which is to give the gift of information to help people get insurance. So I would like everyone in this hall to agree that tonight, or this weekend, sometime this weekend, you're going to call 5 friends. Okay? Call 5 friends. What it is, so this is,
I said that.
You said that too?
5 people.
You have the same. Okay, now make it 10. We're doubling down. You got to call 5 for Senator Mitchell and 5 for me. So let me ask. So when the senator asked this, did she ask for a show of hands of people that said they do that?
No.
No.
Everybody was.
Everyone, if you're willing to call 5 people, raise your hand. Raise your hand. So we have just reached out to 500 Californians. And it's not just California. I want to, California's got it all going on. We do. Okay.
We do.
CoveredCA.com is working just fine. Okay. Thanks to but if you've got family in Louisiana, they have a right to get health care too. If you got family in Texas, you got family in Florida, you call them up. Because healthcare.gov isn't working quite as well as our system is, but it's working. And what's not working is a healthcare system that doesn't give people coverage. That's the glitch that we have fixed. So people talk about computer glitches. You guys, we've had a monstrous glitch of inequity in America for the last 50 years. That glitch is gone. So now you are all calling 10 people. And now they're going to say, another speaker's going to come up, so we become 15. But no, but it does take this. It takes you calling your friends. I have one other question for you. How many of you are on Facebook? Raise your hand if you're on Facebook. Well, I got one more ask for you. When you get home tonight, like Covered California and send a link to your friends. So we already have, thank you very much, we already have over 100,000 folks that like us on Facebook. And they don't like us because we ain't selling anything. They like us because they want to tell a friend. And you're going to be hearing us talk a lot about what this is about. It is about neighbors telling neighbors, family telling family, and that's what you got to do. So it is just such a pleasure to be here with you today. I really appreciate Trinity Baptist sort of reaching out through your community, but I appreciate you coming here to become informed, because it's about you telling your friends and neighbors going to make a difference. So with that, am I supposed to take questions? What am I doing up here, Holly?
You can ask people to write their questions on note cards.
Well, that's a good way to do it.
If there are a few, because I know you've got another event to get to, and so raise your hands if you have a question specifically for Mr. Lee. There's someone in the back. The staff could go. I saw one hand, the gentleman in the hat in the back.
Gentleman in the hat in the back. Step on up, sir. You don't have a hat on.
He didn't call.
Excuse me.
We're going to take those 2 for Mr. Lee.
Okay. So again, I would say that, I want to remind you about some of the basics. It is guaranteed coverage. The other thing it is, there's a lot of talk about insurance companies being out there. Under the Affordable Care Act, there's new rules. When you get insurance, starting January 1, you know it will be there when you get sick, which is not what's happened in the past. Is that people thought they had insurance, but when something really bad happened, one of those little gaps in coverage. Okay? The Affordable Care Act says no more of that. Essential coverage for all the basics you need. And that's really important. So it's a new day. The other place where it's a new day about coverage, and this is important, is insurance is complicated. Okay? It's not a simple thing, but what we've done at Covered California is to say standard benefits. So that means when you're deciding between Kaiser and Anthem and Health Net, you're deciding because you like the doctors in one plan. Not because there's some hidden thing about co-insurance or deductible. The same benefits. We want to make it easy for consumers. And that's what we believe we've done, is everything we do is to have your back. So we went out and negotiated with the health plans, and our job is to make sure that they get you health care. Because the other thing that I would note, if I could, is, we talk about coverage. It's not about coverage. It's about health care. It's about getting people the care they need when they need it, and keeping people healthy. And we are going to be making sure that every health plan that's part of Covered California, when you enroll with it, that then you get that doctor when you need to see them. That if you have something really bad happen, and God forbid, you get that top-end specialist when you need them. It's about care, keeping people healthy, and we're going to make sure that happens. So with that, Senator,
Peter, I have one question, and you can decide if you want to punt it to the panelists. And it says,
one of those medical doctors. Are there doctors out there?
Yes, there are.
Okay, good.
Any provision of Affordable Care Act for increased eligibility of Medicare-only people to get Medi-Cal coverage?
Okay, well, I will do a little bit of a punt on this, but let me tell you a couple things about Medicare and Medi-Cal, how they relate. First, Medicare, if you got Medicare, you keep it. The Affordable Care Act did two things to improve Medicare benefits, okay? Which is, it's crazy that up until Obamacare, the Affordable Care Act, Medicare did not cover preventive services. It wasn't covered, which is crazy. It wasn't helping our seniors stay well. It now provides coverage for preventive services. That's good news. The other thing it does is there's a thing in Medicare called the donut hole. Now what that is a gap in coverage for prescription drugs. It's closing that. So more and more of the prescription drugs are going to be covered by Medicare. Those are the two, that's a big deal. And I want to remind you, when Medicare was passed 50 years ago, it didn't cover drugs, prescription drugs at all. Medicare has been improved year over year to make it better. The Affordable Care Act, it's going to be improved. We're at a starting gate of changing history, and it's going to get better as we move along. But so, with regard to what's called Medi coverage for both Medicare and Medi-Cal, this is something that is actually out of my depth that I'll see if one of the other panelists can speak to.
Beautiful. Peter, thank you so much.
Okay, so thank you all very much for being here.